primary causes of lower back injury and knee injuries in public safety is not always the fact that our back is weak, it's the fact that our spines have become overloaded. And our spines have become overloaded due to this very predictable cascade effect that's referred to as a lower cross syndrome. Here's what happens. We sit for long periods of time and we're very compressed at the hip joint. The hip flexors are compressed, and a very important spine stabilizer and trunk flexor called the psoas becomes very compressed and tight. When they become compressed and tight, what they do is they take the center of gravity in the pelvis, which should be in a nice neutral spine, a safe lifting posture, and they pull everything forward. So the center of gravity shifts forward, the pelvis rotates out of position. When that happens, it inhibits the abdominal wall. Well, we all know strong abs, strong back. But what happens is as the pelvis is pulled forward, we're not in neutral spine anymore. Abs are inhibited, not doing their job. The spine naturally becomes overloaded, and we sustain injuries doing things that should have never hurt us. So as that's going on, the body kind of wakes up, and it realizes that it's way out of position. These aren't doing their job. Way too much strain in the lower back, so it fires the hamstrings. They get tight to try to pull you back into place. So there's this tug of war going on between the front and back of the body, and ultimately the spine is caught in the middle. So as this tug of war is going on, and we're feeling more discomfort in our backs and our knees, the most important muscle group in the body, which is your hips and your gluteal muscles, become very inhibited and very weak. They sort of get confused. And when your glutes get confused or inhibited, a couple of things happen. Number one, that's where most of your power generation for lifting, pulling, pushing, or transferring a patient come from. That's where a lot of your balance comes from. But your gluteal muscles have a secondary job, which is as a hip extensor and as a hip external rotator, to rotate the femur. When they don't do their job properly, normal things like going into a squat to safely pick up a patient, when you go to come up, glute doesn't fire, knees turn in, and you end up lifting with your back. Therefore, we start sustaining injuries, even if we thought we were lifting properly, doing things that should have never, ever hurt us. And it's all this cascade effect called lower cross syndrome causing these types of injuries.